Have you ever heard that ejaculating more might reduce your risk for prostate cancer? I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast. Today we have our monthly AMA, and we are going to be answering your questions from our membership and our subscribers. If you want to be a member and see the full-length episode of our AMA, make sure to sign up at renamalik.supercast.com, where you can ask me anything and get early access to all of our podcast episodes, as well as transcripts from the membership. So let's get right to it.
Okay, my doctor prescribed me Cialis for ED, but I remember using a Viagra pill a long time ago that I got from a friend, and I recall it working well too. Is one better than the other? If so, should I be asking my doctor for one of these?
Yeah, great question. I get this question a lot. And I think that really what you need to understand is that these medications work by the same mechanism. What essentially they do is they inhibit a certain enzyme, which then allows blood flow to stay in the penis for longer so that you can get an erection and maintain an erection for longer. But there are distinct differences in these medications, and these differences may be more relevant to you or not. These do work about 60 to 80% of the time in men with erectile dysfunction. Now, what is the big differences? So big differences when you think about sildenafil and tadalafil, or Viagra and Cialis, which are the brand names. With both medications, you can have some similar side effects, and these can include things like having a stuffy nose or feeling like congested or flu-like after taking the medication, or having headaches or flushing of the skin. With sildenafil, typically it has a shorter half-life. What this means is that when you take it an hour or so before sex, and it works somewhere between 30 minutes and an hour after taking it. And you can take it even before, because it'll last about 4 hours. And so if you want to have sex in 2 hours, you can still take it. It will just be ready when you need it. It doesn't give you spontaneous erections. None of these medications do. So that's really important to realize. I think a lot of people tend to worry that you're going to get this spontaneous erection and you're not going to be able to get rid of it, which is not the case. Now, in terms of tadalafil, it lasts a little bit longer. It has a longer half-life, which means it sticks around for about 36 hours. So for some people, that allows for more spontaneity, meaning that you can take it and then you can have it last for up to 3 days. You can use it over the weekend and maybe have multiple episodes of sexual intercourse. Now, the other thing is sildenafil is absorbed through the stomach, and so you don't want to take it with food. If you take it with food, it actually reduces what we call the bioavailability, meaning that's less available for your body to use. You still might get side effects, but it won't be as effective. Whereas tadalafil, you don't need to worry about taking it with or without food. So depending on what time you like to have sex, if you tend to like to have sex after dinner, then tadalafil might be better for you. Also, there's been studies that have shown that taking these medications, the first time you use the medication, it doesn't always work. It can take up to 8 times to get to up to 80% efficacy with a medication like sildenafil. Now, when you look at tadalafil the first time, the efficacy is around 75%. But remember how I mentioned that sildenafil tends to work within 30 minutes to an hour. We say that typically that's very similar for tadalafil, but in some cases it can take even longer. And so if you want something that works relatively quickly, maybe sildenafil is better for you. Other side effects that are different in terms of sildenafil is that sometimes you can get blue-green vision discoloration because it affects some of the same receptors in the eye. If that happens, you want to stop the medication immediately. Now, with tadalafil, it can cause muscle aches, and so sometimes that's really bothersome to people and they can't tolerate it. But generally speaking, both medications work. Both medications can be effective. Now, some people will prefer the erection they get with sildenafil, and some people will prefer the erection they get with tadalafil. And the good news is, if one doesn't work, that doesn't mean you can't try the other one. So absolutely try one, and if that works well, continue with it. If it doesn't work well, you try the other one. And there are also other options like vardenafil and avanafil that are usually a little bit more costly and usually not as readily used, at least in the United States, because of the cost. But if you're interested, you could certainly try those as well.
Next question. I saw a clip of you on a podcast, and it said something like, quote, if you ejaculate 20 times a month, end quote, or some version of this, that it will help protect against prostate cancer. What's the story behind this? I'd like to understand this more.
Yes. So there's one study that looked at ejaculation frequency and its risk with prostate cancer. So they categorized men in how often they ejaculated. Was it 0 to 7 times per month? Was it 7 to 14, 14 to 21, and more than 21 times per month? And they tried to control for a whole bunch of other things like diabetes, other comorbidities, heart disease, all those sorts of things, lifestyle, a variety of different things. And what they found was that when men ejaculated 21 times or more per month versus less than 7 times per month, they were significantly less likely to get diagnosed with prostate cancer. Now, does that mean that ejaculating more frequently is protective in some way? So there's some theories as to why this might actually be. So theory is one that you're having some stagnation of fluids around the prostate when you're not ejaculating. And that potentially that stagnated fluid may then create inflammation or create other sort of niduses to create abnormal cells, and that will then lead to prostate cancer. Now, is that 100% true? Is that universally true? We don't know. This is just the theory behind it. So the idea that you're ejaculating more frequently, you're sort of cleaning the pipes, and that's sort of protective in some way. Now, this is one study. It is a retrospective study. It is not where you randomize people to ejaculate or not ejaculate, then followed them for 10, 20 years to see if they got prostate cancer. So it has limitations, but I use this study to tell people that you can ejaculate, whether it's with your partner or by yourself through masturbation, and it is safe to do so. And so you're not going to harm yourself in any way by ejaculating 21 times or more a month. In fact, it might help you. Now, is 21 times is like benchmark you have to reach to get that protective effect? No, probably not. And so again, I think the take home from this study is that feel free to ejaculate, whether it's by yourself or with a partner, without guilt, and understand that there is potential benefit. And so really there's little downside for it in terms of a physiologic benefit.
You talked to Dr. Stacy Loeb about that, I believe, right?
Yeah, I talked to Dr. Stacy Loeb, who is a prostate cancer expert, on the podcast. I've also made a video about it. So check that out. I also put some videos from our last question about the medications that I've made on tadalafil and sildenafil as well.
All right, so do check that out. Next question. If in a pinch I run out of lube, what is something I have in my kitchen or bathroom products that I can use that won't harm my vagina or my man's penis during sex?
Absolutely. So this is a good question. I like lube a lot. I think lube is really great. It allows sex to have less uncomfortable friction. And I think that everyone should use it if they so desire, because lubrication can vary over time and it's not always indicative of arousal. Lubrication can change when women are lactating through hormones, through certain medications. And it doesn't necessarily mean that they're not aroused or not turned on by you. It just means that they necessarily at that point in time are not making as much lubrication as they are. And of course, we want sex to be pleasurable. And when it hurts, it can be pleasurable. So making it more comfortable for both you and your partner, and honestly, a little bit more fun, can be great. Now, I've made videos about lubrication and talking about different kinds of lubes, water-based, silicone-based, oil-based, all of which have pluses and minuses, are really down to personal preference for the most part in terms of what you like or do not like. Now, in terms of what can you do at home, a lot of people will tend to go towards like things like Vaseline, which I don't recommend, but you can use oils. And so specifically coconut oil is one that people tend to like because it's a little thicker when you take it out and it doesn't like make a big mess. But you can also use olive oil. And those are generally safe and generally don't cause a lot of damage or harm to your genitals. Now, some people can be sensitive even if you're using an oil. And that's just because maybe their microbiome is a little more sensitive and needs a very specific pH. But for the most part, it's safe, it's natural. And with coconut oil, there are some sort of antibacterial properties or anti-inflammatory properties in coconut oil, and so that can be beneficial as well.
All right. I won't be looking at coconut oil and olive oil the same after that. All right. Next question. I am curious as to your thoughts on the impact of finasteride on prostate health and sexual health more broadly.
Okay, finasteride is a medication that we use for enlarged prostate, and some people use it for hair loss at lower doses, or you've called Propecia is the other brand name for it. So essentially, finasteride and dutasteride are two medications that work by blocking the conversion of testosterone to DHT. DHT, or dihydrotestosterone, is the main androgen in the prostate, and so that tends to slow down prostate growth and even cause prostate shrinkage up to 50% of its original size. size. And so that's why it works. It's effective in reducing the size of the prostate. It also reduces your PSA, which is a blood test that screens for prostate cancer, by 50%. And so you need to sort of assess and see when you get your PSA, if you're on finasteride, you need to double it to get the actual PSA value. So finasteride's been really studied. We had a very big study in urology called the MTOP study that looked at finasteride as a prevention for prostate cancer, or does it actually cause a reduction in the incidence of prostate cancer. And what they found was that it didn't actually increase the incidence of prostate cancer, but when prostate cancer was found in men who were on these medications, it was of a higher grade. And likely, I think that's because to some degree, there is this decrease in PSA with the medication. But obviously this was in a controlled setting. And so people who were doing the study knew that obviously your PSA would decrease by half. So a very good study that shows that information. But this medication, as I mentioned, is really great for BPH. Now, typically when we talk about medications for BPH, we'll talk about things like Flomax or tamsulosin or silodosin or alfuzosin, these sort of medications that are called alpha blockers. Now, those work by relaxing the bladder neck to allow urine to flow better past the prostate and relaxing the prostate. And so these medications are typically first line. And when you add a medication like finasteride to those medications, you actually so significantly improved overall urinary symptoms. So people are urinating more better. They're not having a weak stream. They're not waiting for their stream to start. They're not having a stop and go stream. They're not waking up so much at night. And so they're seeing improvement in their urinary symptoms with both those medications together. And so those are sort of the benefits and potential risk with the prostate cancer issue with finasteride. Now, the other issue is sexual. And so we definitely see a risk of sexual side effects. I've made a full video on the side effects with tamsulosin and finasteride. So check that one out. I'll put it in the show notes as well. But ultimately, these medications can have sexual side effects. And most commonly, it's decreased ejaculation or having less volume of ejaculate, but it can also be low desire. And so there's this thing called post-finasteride syndrome. And essentially there's a very small subset. So this is like very small numbers of people who've taken finasteride and they've noticed that they have a significant decrease in desire after taking finasteride, which persists for some time, even after stopping the medication. And so that is something that is, still sort of we're still trying to figure out the best optimal way to treat those patients. But I think this is a real thing and something that I caution people on very frequently. Now, if you have BPH and you're taking tamsulosin and you're thinking about taking finasteride, there's one other medication a lot of people don't know about that can help you with your symptoms. And that's tadalafil. So the medication we talked about earlier, you can actually take a low dose, 5 milligrams every single day. And that also helps relax the prostate and allow urine to flow better. So for men who have both an enlarged prostate and some struggles with erections, actually taking a low dose of tadalafil may be able to knock two birds with one stone. Thank you guys so much for joining me today. If you want to get the rest of the questions that I answered on today's AMA, make sure to sign up for our membership at rinamalik.supercast.com, where you can access our AMA and ask questions there. You can also get access to early releases of the podcast as well as transcripts from the podcast. So make sure to check that out. And if you guys are enjoying this, please make sure to share this channel with your friends and let them know about the channel. And if you're not subscribed, what are you waiting for? Make sure to subscribe to the channel, show your support with just one click of a button. And as always, remember to take care of yourself because you're worth it.